Keto, Paleo, vegan, Atkins. There's so many diets around, it's easy to get confused about which one is best for you and for your skin. Well, I'm going to get the answer for you on this video today. My name is Dr. Anthony Youn, and I'm known as America's Holistic Plastic Surgeon. I help health-conscious men and women look and feel incredible using the right foods, clean skincare, and the latest non-invasive treatments. And if you are considering actual surgery, I'll show you how to do it safely and holistically. But today we're going to focus on food. There's so many diets out there. There are fad diets, there's the standard American diet, there's a Mediterranean diet. How do you know which one to choose? How do you know which one to follow? Where I'm going to go over on this video all of the ones that you need to know about, and we'll talk about my beliefs in each of these. So the standard American diet is a diet that probably the vast majority of Americans and Canadians are eating. The standard American diet consists of a lot of processed foods, foods that are filled with chemicals because they've been processed, factory farm meat and with antibiotics, dairy products that are packed with hormones, and tons of sugar and salt. Now, admittedly, I grew up eating this type of a diet, combined, maybe unusually, with a standard Korean diet, which is on the opposite side, very, very healthy. So the standard American diet is probably the worst diet in the world because of all these things that it is filled up with. And we do see studies that show that people who eat the standard American diet are not as healthy as people who eat some diets that I'm going to talk about on this video today. So once again, standard American diet, this is what the vast majority of people are eating. I recommend that you stay away from it. Well, what about the Atkins diet? Well, about 10-15 years ago, the Atkins diet was super popular, and people were losing a ton of weight on the Atkins diet. Now, traditionally, the Atkins diet was thought of as being high in fat and protein, low in carbs, and that was a big thing. You go low carb and you tend to lose weight. Well, the issue, though, is that some people took the Atkins diet and they took it to this extreme. They started eating tons of meat and cheese. So the classic example of this that you would hear about when this was such a craze is that people would go to fast food places and they would buy burgers and just hold the bun. And they say, well, geez, I'm having a burger, I hold the bun, it's healthy, it's Atkins. Well, no, it's not. It's terrible for you. So apart from it having bad foods in it, once again, dairy and all of these types of meat, is a lack of fiber and the phytonutrients. You get so much fiber and phytonutrients that your body needs through fruits and vegetables. And you can't get fiber through anything that's not a fruit and vegetable. Meat and dairy, they do not contain any fiber. So the Atkins diet, the general Atkins diet, is bad for your gut, it's bad for your skin, and it's bad for your heart. And the way I look at Atkins, it's kind of like a dumbed down version of keto. On the other side, keto is like a more intelligent version of Atkins. Now, I need to say that this is not necessarily the Atkins diet of today. I know that the Atkins diet today, the company and everything, has updated things, they've changed things, so I'm not commenting on the official Atkins diet, but this is the idea of the Atkins diet that so many people have followed over the last 15 years, and unfortunately ending with having some health problems potentially from it. So once again, not stating that this is the Atkins diet that is branded today. So what about the ketogenic diet? I just said that the Atkins diet is a dumbed down version of keto. Well, keto is a very, how would I say it, intelligent type of a diet. It's something where you really have to watch what you're eating because the goal of keto is that you want to create ketones. Because ketones, when you literally reduce the amount of carbs that you're eating so much, your body will actually change what it uses as fuel, and eventually it starts to use ketones. Well, ketones are actually great fuels for your brain, and it's a great fuel if you want to lose weight. So the ketogenic diet basically is a diet that is high in fat, healthy fats in general, low in carbs, and moderately low in protein. Okay, so the big difference between the ketogenic diet and the Atkins diet is protein. So many people ate that, once again, that traditional, that Atkins diet, and they're having so much meat, so many eggs, and they're having so much protein. Well, the protein will prevent you from developing the ketones and getting into a ketogenic state. And so if you're truly going to do a ketogenic diet, you actually want to monitor your urine for ketones, and you want to once again go high in fat, low in carbs, and fairly low in protein. So the ketogenic diet has been studied and actually is recommended for certain people with medical issues, especially people who have neurologic disorders. There are people who have epilepsy who have nice improvements in their epilepsy by going on a ketogenic diet. And we believe it's because the brain can work and function very well based off of ketones. So if you've got neurologic issues, a ketogenic diet is something that you may want to talk with your neurologist about because it may help you. The issue that I have with the ketogenic diet, however, is the lack of fiber and the lack of fruit. So for the ketogenic diet, you eat relatively, pretty little fruit. And I just can't myself believe in a diet that says that fruit is not good for you. It's contrary to everything I've ever believed in and everything I believe in now. And so because of that, I'm not a huge fan of the ketogenic diet. I think for certain types of individuals, like I said, some of those with neurologic disorders and some other types of medical issues, the ketogenic diet may be worth a try. But because of the lack of fruit and the lack of fiber that some people develop in the ketogenic diet, I'm not a big fan of it as a long-term diet or a diet for the general population. Well, the next couple of diets I think are on the other side. These are diets that I think people can thrive off of and are very good for your health. So let's start with a vegan or a plant-based diet. A vegan diet basically contains no animal products, and that means no meat, no dairy, and no eggs. There's a difference, however, between a whole foods, plant-based vegan diet and a processed vegan diet. There are people that joke that, oh, you can have sugary cereal, that's vegan. You can have Twinkies, that's vegan, but it's not healthy, plant-based whole foods vegan. And so really you need to make the distinction there. I think we also need to make the distinction between people who are eating plant-based for their health and people who are eating plant-based and vegan because of their moral beliefs. And I really want to I guess I just want to state my admiration for those people who are vegan, who are plant-based, who because of their moral convictions don't eat meat or don't use animal products. I commend you and I admire you. I wish that I could be like that. I just don't find that I thrive off of a whole foods, completely plant-based diet. However, I do believe that for heart health and possibly for cancer prevention, a whole foods plant-based diet is no question the best. So there are cardiologists. There's a good friend of mine, Dr. Joel Kahn, who's a plant-based whole foods vegan cardiologist. So many studies out there that are showing that a whole foods plant-based diet is great for people who have heart disease. And there are even stories of patients who've had debilitating cardiac disease and have reversed it by going on a whole foods plant-based diet. I mean, it is incredible what some people do. So if you've got issues with your heart, if you've had a history of a heart attack, possibly too, if you've got a history of cancer or you're dealing with cancer, going on a whole foods plant-based diet may be a very good option for you. So talk with your doctor about it. Well, what else is there? There is the modified paleo diet. So this is a diet that is followed by a lot of functional medicine practitioners. There are some of the most prominent functional medicine doctors like Dr. Mark Hyman. He has one that he calls the, what is he called? He calls it the Pegan diet, where it's primarily plants. Meat is used as a side dish. Dr. Terry Walls, who is a trailblazer for treatment of autoimmune disease and multiple sclerosis, recommends a modified paleo diet for her clients. So what is that? Well, this is a diet that is low in carbs. It's dairy-free and gluten-free. There's this belief, and I agree with it, that dairy and gluten can be very inflammatory to your gut and to your body. A modified paleo diet is rich in vegetables and in choice, and it really does, and it does include choice meats, meaning that you eat mainly vegetables with a smaller amount of meat. And that meat is choiced. You want to have it grass-fed or pastured. So if you're talking about beef, you want to have grass-fed beef. If you're talking about pork or chicken, you want to have it pastured or pasture-raised. If you're talking about fish, ideally wild-caught fish. The modified paleo diet includes basically no processed foods as well. So low in carbs in general, you want to go free of the dairy, free of the gluten, rich in vegetables, choice meats, once again, high quality meats, and no processed foods, ideally organic foods. Now, we do find that with a modified paleo diet, there's so many people where they go off the dairy, they go off the gluten, they really increase their amount of vegetables, they get rid of the processed foods, GI conditions get better, autoimmune conditions get better, even chronic pain can get better. I hear stories of patients all the time who leave comments on my YouTube channel, that send messages to us via Instagram, that they went off gluten and their joint pain got better. So many of these types of stories. And if I had to pick one myself, this may be the one that I try to emulate myself. And there's also the Mediterranean diet. Now, the thing with the Mediterranean diet is there's no one single type. It's not like one person coined this term and has a very defined definition of Mediterranean. But in general, the Mediterranean diet includes plenty of fruits and vegetables, beans, nuts, seeds, olive oil, and wine. So this is what people basically in Italy, in the south of France eat, but all of those around the Mediterranean. It does include small amounts of fish and poultry. So unlike the standard American diet, we're not talking about these massive chunks of meat. Smaller amounts, they're more like side dishes. The Mediterranean diet does contain, however, some bread and whole grains. And this is where the Mediterranean diet differs from the modified paleo diet. The modified paleo diet does not include gluten in general. And studies do show when you look at longevity, who's going to live the longest, who's going to have the most health, the Mediterranean diet is always at the top or near the top of the types of diets. And so if you're looking at longevity, if you're looking at living the longest, this just may be the one that you want to pick. So if I were to pick one, like I said, I think the Mediterranean diet is great, the modified paleo diet, the vegan diet, whole foods diet. If you are convicted to do that, by all means, I encourage you to try that. But with all these diets, you do want to talk with your physician before undertaking it because some of them may not be good depending on the medical situation that you're in. And if you're interested in learning more about what to eat to look younger, check out this video right up here.